Welcome back to The Explainer. Today, we're diving straight into a massive, high-stakes moment in the world of medical regulation. We're looking at a severe intervention that recently sent absolute shockwaves through the healthcare community. If you've ever wondered how clinical trials are actually policed and what exactly happens when the national watchdogs finally bare their teeth, well, you are in the exact right place. Let's get right into it.
Okay, so take a look at this number, 2. Doesn't sound like much, right? But in the world of clinical regulations, it is staggering. This represents an unprecedented 2-year suspension handed down to a major hospital's ethics committee. Think about it. Clinical research moves at lightning speed. Funding is tight, and trial continuity is absolutely everything. A full 24-month halt? That's not just a pause. That can completely derail a drug's development life cycle, jeopardize critical trial funding, and seriously delay getting potentially life-saving data out into the broader medical community.
To make sense of all this, here is our roadmap for today. We'll start with the headline, this 2-year regulatory halt. Then, we'll define the key players, the guardians of patient safety. After that, we'll step inside the CDSCO decision, break down the rule breaches, and finally, look at the very real-world ripple effect of a suspension like this.
All right, Section 1. A 2-year regulatory halt, the headline.
So here is the core fact. The CDSCO officially suspended the ethics committee at HCG's Bengaluru hospital for 2 solid years. Now keep in mind, HCG Healthcare Global is a huge, highly prominent institution. They are a massive name, especially in oncology and advanced cancer care, and Bengaluru itself is literally a hub for medical research and innovation. So having an ethics committee suspended in a facility of this caliber, well, it's a really big deal. It's not just an administrative hiccup. It is a full stop on their ability to locally authorize and oversee new, groundbreaking clinical research. It forces a sudden pause in an environment that heavily relies on constant forward momentum.
Which brings us to Section 2, Guardians of Patient Safety, the actors.
So who exactly are the players here? First, you have the CDSCO, or the Central Drugs Standard Control Organization. These guys are the ultimate national watchdog. They're the apex authority enforcing clinical rules, drug standards, and medical compliance across the entire country. Think of them as the overarching shield for public health. They grant the permissions that allow clinical trials to even exist in the first place, and as we're seeing right now, they have the formidable power to yank those permissions away the second strict national standards drop.
Now, on the flip side of that massive national authority, you have the local ethics committee. These are your boots-on-the-ground gatekeepers, operating right inside a specific hospital. Their one and only mandate? Ensuring the safety, rights, and well-being of the human participants in clinical trials. They review the nitty-gritty of the protocols, check for potential risks to patients, and actively monitor ongoing trials. Honestly, they aren't just bureaucrats shuffling papers around. They are the literal guardians of human lives at the localized, day-to-day level of medical research.
Moving right along to Section 3, inside the CDSCO decision, the conflict.
Now, what's really fascinating here is the massive gap between what's expected of these committees and what actually happened. An ethics committee is strictly mandated to maintain ironclad patient protection and absolutely flawless protocol adherence. That is literally their foundational purpose. But in reality, the national watchdog cited some severe shortfalls. We're talking about regulatory noncompliance triggering a major penalty. And when you see noncompliance of this magnitude, it usually points to critical failures. Things like failing to secure proper informed consent from vulnerable subjects, or allowing unapproved changes to trial protocols without proper administrative review. So when the CDSCO looks at a local gatekeeper and sees a vast gap between expected patient protection and the actual day-to-day oversight, well, friction is pretty much inevitable.
And that leads us straight into our 4th section, Rule Breaches Explained, the breakdown.
So the crucial point is understanding how a breakdown in compliance actually happens. This kind of intervention is usually rooted in a systemic domino effect. First, you get a failure of local oversight. The localized board misses a red flag, or standard operating procedures quietly start slipping over time. Then, that lack of vigilance leads to protocol deviations in the trials themselves. The highly controlled environment of the medical study starts to drift. Maybe adverse events aren't reported fast enough, or vital patient monitoring schedules are missed. And finally, boom. These infractions are discovered by the national watchdog, which triggers immediate action.
Let's see how this all builds up to the final penalty, because it operates in a very logical sequence. Step 1, the local ethics committee experiences a failure in maintaining strict compliance. Step 2, the CDSCO conducts an audit. And these aren't just casual check-ins. Regulatory audits are deep, intense dives into trial paperwork. They are actively hunting for mismatched case report forms, missing signatures, or unreported side effects, and they discover the non-compliance. Which brings us to step 3. Because the stakes explicitly involve human safety and the integrity of medical data, the CDSCO is forced to intervene heavily, mandating that 2-year suspension. A failure in the administrative boardroom fundamentally halts all the action inside the laboratory.
Finally, we reach our last section, the ripple effect, the impact.
We need to zoom out a bit and understand what this timeline means for the broader medical community. Pre-suspension, you've got an environment of active trial oversight. Research is progressing, vital data is being gathered. But then we hit the 2-year freeze. For 24 solid months, the functions of this specific ethics committee are completely halted. They absolutely cannot approve new trials. This severely paralyzes local clinical research operations. And looking ahead to the post-suspension era, it's not just a matter of flipping a switch to turn things back on. Rebuilding compliance requires heavy scrutiny, rigorous staff retraining, probably some external audits, and definitively proving to the national watchdog that they can actually act as gatekeepers once again.
And this brilliantly illustrates the cascading consequences across the entire healthcare ecosystem. Look at ongoing research. Active trials often have to be completely reassigned to other, compliant committees just to continue safely. Then you have future trials. They are outright blocked at this specific location for 2 full years, which obviously delays potentially vital medical research. But here is the most important takeaway of all: patient safety. The ultimate consequence is that safety is protected via this regulatory crackdown. The entire system, even with these heavy-handed suspensions that cause massive logistical headaches, is fundamentally designed to prioritize the vulnerable patients who put their trust in clinical trials over the sheer speed of medical advancement.
Which leaves us with a rather profound final thought to ponder. As we see with the CSDSO suspending the HCG Bengaluru Ethics Committee, when the actual guardians of patient safety face suspension, who watches the watchers? It really highlights the delicate, absolutely essential balance of medical ethics, regulatory accountability, and the total necessity of strict, uncompromising oversight. Thank you so much for diving into this complex but incredibly important explainer with me today. Keep asking the hard questions about the systems we trust, and I'll catch you next time.